Contingency management is an intervention primarily used in the treatment of addiction that involves providing incentives to encourage positive behaviors, including being engaged in treatment activities. The following videos are demonstrations that address key principles on how to implement contingency management effectively and competently. One of the first steps in developing a contingency management program for an individual or a group is to define a target behavior. Target behaviors to be incentivized through contingency management need to be specific, objective, and observable. Often clients will express treatment-related goals that they want to achieve, but these goals are vague, lack direction, are not clearly objective, or are unattainable within a reasonable time frame. It can be unclear how some of these behaviors would be observed. In these instances, it is important that the contingency management provider works with the client to operationalize the desired goal. In this example, the client wants to revisit their interest in drawing as part of a goal to increase their self-care. Pay attention to how the provider helps the client to develop a clear target behavior that they're able to verify.
Hi Matt. So last week we talked about the importance of practicing self-care, and a lot of times that will involve doing things that make us feel good. Is there anything that you used to do in the past that made you feel good, or something that you'd want to re-engage in or you can do more of?
Yeah, I used to do a lot of drawing, like growing up as a kid and a teenager. I'm actually pretty decent at it, but along the way, just with my addiction problems and feeling depressed, I just stopped at some point, and it's one of those things I know if I did, I would feel good, and but I've just been in a rut. But I guess that's something I should be doing more of.
Is that something that you would like to set a goal around?
Yeah, sure.
Okay. What would you need to get started with that? Any specific items?
Well, I think I have everything. I have a sketch pad and like artistic like pencils that I can use, so I'm good there.
So tell me, what might you draw?
I kind of just look out the window and do like a quick like sketch of what I see.
Okay, that sounds interesting. How long would that usually take you?
I mean, a lot of times like as quick as like 10 minutes or maybe longer if I want to like work a bit harder or add more detail.
So how about we set a goal of drawing at least 3 times a week for at least 10 minutes? Does that sound like something that would be manageable for you?
Yeah, I think so.
All right, so here's what we can do. How about on Mondays, Wednesdays, and Fridays, you send me some kind of proof that you have either a work of art in progress or something that's completed. And I want you to remember that we have to be strict when checking compliance, just so we're fair to everyone. How about you send me a before and after picture of each artwork that you do, either by text or by email, before midnight on Monday, Wednesday, and Friday. Also let me know what time you started the drawing and what time you completed it. The days that you choose to draw on are completely up to you. I just want to make sure that I get that verification on Monday, Wednesday, and Friday. Does that make sense?
Yeah, that's fine. Yeah, that sounds good.
I will send you a link to the prize draw, usually within a few hours of receiving your verification. But that will all depend on when I receive the verification. If you happen to send it at 5 p.m. when I'm out of the office, I will usually send it the next morning as soon as I'm back in. Does that make sense?
Yeah, I think so.
Okay, great. I will send you a printout of what we've agreed upon, as well as the prize draw rules that we discussed earlier. If anything is unclear, please let me know. I really look forward to seeing some of your illustrations.
Okay, sounds good. Notice how the contingency management provider took the client's goal of wanting to draw more and specified that goal, made it attainable for the client, along with describing how exactly that behavior would be observed, and provided them with additional instruction materials. It is crucial that the client have a clear understanding of how to demonstrate the target behavior so that they know how to earn incentives. Another issue to keep in mind is that the target behavior be actionable, or in other words, not a dead man goal. In short, a dead man goal is a goal that can be done by a dead person. A client saying that they are not going to use meth is an example of a dead man goal. A way to make that actionable would be to have the client present to the clinic weekly to provide a urine sample for analysis to demonstrate that there are no methamphetamines in their system. Not only should the client clearly understand the target behavior, but they need to also have a clear understanding of the contingency management program rules and how the incentive schedules work. so they know what to expect when they do or do not demonstrate the target behavior. Furthermore, having a clear understanding of the rules and incentive schedules helps strengthen the association between the behavior and the reward, which in turn allows the incentives to compete with the rewarding effects of substances or the problematic behaviors they are trying to overcome. The rules need to be discussed with the client before the start of the program, but also emphasized throughout the program. In this next example, notice how the counselor clearly describes why the client received the incentives, as well as what they can expect to receive in the future if they continue to demonstrate the behavior. They also remind them to refer to their handout materials if they are ever unsure about the rules or their draw amounts. In this demonstration, the provider shows how they are adhering to the CM program protocol, as well as displaying competence in delivering CM by promoting a positive and enthusiastic attitude. The target behavior in this case is attendance.
So Matt, you've attended your recovery skills group 6 times consecutively in a row, and each time you've been going up by 1 draw per week. So now you're up to 6 draws this week. Let's see what you get in the prize draw.
Sweet. All right. Okay, number 1. Okay, $1.
$1, nice.
Okay, I got a positive affirmation.
Okay, would you like to read it?
Sure. I am proud of myself and all that I've accomplished. Cool. $5.
$5, nice.
Sweet, another $5.
Nice.
Okay, another positive affirmation.
Okay.
All right. The tools I need to succeed are in my possession. All right. Well, I suppose that's true. Mm-hmm. Okay, last one. Another positive affirmation.
Okay.
Hey, they're all right. It's fine for me to make mistakes because I can adapt.
Mm-hmm. Cool. Okay. All right, Matt. So that's awesome. So this week you received a total of 2 draws for $5, 1 draw for $1, and then 3 affirmations. So that brings the total today up to $11, but your total contingency management bank account is now at $36. Great job taking part in your treatment. I just want to remind you that if you attend your next group session, as well as your one-on-one counseling session, that will give you an additional 2 draws that week. So that'll bring the total up to 8 draws. And that's only 4 away from the maximum total of 12 draws. You're doing great. Keep up the good work. Just make sure you refer to the incentive schedule handout that I gave you earlier. If you're ever unsure of how many draws you're going to be getting, you can refer back to that so you know how many you're going to be earning based on that treatment schedule.
Sounds good.
I'll also take this time to remind you that if anything ever comes up and you have to reschedule your treatment appointments, just please try and let us know at least 24 hours in advance. That way, your draws will not reset. As we discussed before, we will only accept an excused absence if it's at least 24 hours before the session. I just want to remind you of that because we don't want your draws to reset back to 1 if you can't attend for some reason.
Okay, that sounds good.
So this time you have that $36 in your bank account. Are you interested in redeeming a gift card at this time?
Actually, yeah. I could definitely use some groceries and maybe treat myself to a bit of candy. So I'll get a $30 grocery store gift card.
That sounds good to me. It's exciting that you're choosing to redeem a gift card at this time. You definitely earned it. You've been really consistent in attending your treatment.
Awesome. Thank you. The other side of administering contingency management is withholding the incentives when the client does not demonstrate the target behavior. It is important that the provider remains supportive and not portray the absence of incentives as a punishment. In the following demonstration, the target behavior for the client is abstinence from methamphetamine, which is verified through a urine screen. For this week's visit, the client tested positive for methamphetamine. Notice how the contingency management provider remains positive and applauds the client for showing up to the clinic to provide a urine sample, even though they recently used methamphetamine.
So Matt, you tested positive for methamphetamine, but I just want to let you know that I think it's great that you decided to come into the clinic. I know it can be really difficult, especially after using, but it shows a lot of progress that you made the decision to still come in today.
Yeah, I kind of had a tough week.
Yeah, so it's completely normal to have ups and downs, but the important thing is that you're still coming into the clinic and you're still engaging in your treatment. As far as the vouchers go, you will have many more opportunities to earn higher amounts and see that escalation happen. You've earned a few dollars already and you should be very proud of that. So next week, the voucher amount will reset to $250, but then following that, it will start to escalate again if you provide clean urine samples. But again, I really want to congratulate you on coming in. It's a big step and it shows a lot of progress.
To help get clients excited and engaged with contingency management and in turn their treatment, it can be helpful to discuss and set goals regarding what rewards or prizes the clients would be interested in working towards. This gives clients direction about what they're working towards and allows them to reflect on why certain rewards might be valuable to them. For example, if a contingency management program is employing the prize method, the providers can show the client what the available prizes are in the prize cabinet. Alternatively, if a contingency management program is employing the voucher method, you can discuss what goods or services they would like to eventually redeem with their accumulated vouchers. In this next demonstration, the provider asks the client to reflect on what available gift cards they might be interested in working towards. The target behavior in this case is attendance.
All right, so now that we've reviewed the contingency management program rules and you have a general understanding, were there any gift cards that caught your eye or any ones that you'd be wanting to work towards?
Yeah, I thought the options were pretty good. I enjoy taking my daughter to the movies, and there's some Cineplex gift cards, and the movies can be expensive, so that could be something. Christmas is around the corner, so again, with my daughter, some of those toy store gift cards might be something I would want to work towards as well.
Yeah, that sounds great, and I'm sure she'd really appreciate it.
Yeah. Her mother's had to chip in a lot, just with me dealing with everything, so I try to chip in when I can, and these could be helpful. So.
Yeah, for sure. Well, I think that sounds like a great idea, and it sounds like your daughter is a great motivation for you.
Yeah, for sure she is.
Well, I'd say you're off to a great start this week. You've attended your one-on-one counseling as well as your mindfulness group. Just as a reminder, each time you earn draws, that increases your chances of building up that contingency management bank account balance that you can later put towards those gift cards you have your eye on.
Okay. By identifying a gift card of interest, now the client has something specific to work towards. Even more, the client wants to earn draws to redeem gift cards that he can use for his daughter, which increases the personal value of the incentives. Most contingency management programs are time limited. Given that contingency management can be a positive aspect of patients' lives, they may have concerns when the program comes to an end. Clients should be reminded of the ending date at least a couple of weeks before the end of the last contingency management related visit. At the final contingency management session, you should reflect on the client's experiences with the program, ask them about any feedback they may have, and encourage them to continue with their usual treatment and recovery. Finally, you should congratulate them for their accomplishments. Some programs may provide a certificate of completion for the client to recognize their progress. The following demonstration illustrates the care provider informing the client about the end of the program and preparing them for what that might look like. In this example, the provider informs the client in week 10 of a 12-week program.
Matt, you've been doing great consistently attending your treatment. You are currently in week 10 of the contingency management program, so that leaves another 2 weeks remaining. So the program will be ending on August 18th. You will continue to receive the draws each time you attend up until that point, but after that, the draws will stop. Would you like to take some time to reflect on how you feel about the contingency management program coming to an end?
It's okay, I guess. I knew it would come to an end. I didn't realize how soon.
Well, I apologize that you thought it was, going on longer than it actually is.
Yeah, but I can still attend my regular groups, right?
Yes, of course. Just because the contingency management program is coming to an end, it won't affect your treatment going forward. And I hope that you continue to attend.
Yeah, I definitely wouldn't want to stop attending at this point. I feel like I'm really enjoying my group therapy and making progress, and I just feel like I have a deeper understanding of my recovery. So yeah, I definitely want to continue.
Yeah, that's really nice to hear. We often see that prizes are of great interest to people in the early stages, but as time goes on, we usually see that people start to see the incentive and the benefit of attending the treatment, and the prizes become less important to them.
Yeah, so I'm about 8 weeks into my recovery group, and my counselor seems to think I'm ready for the mindfulness group that starts in a couple weeks, and it's actually a more convenient time, so I'm looking forward to that.
That's really awesome, and it sounds like a great group, and I really hope you enjoy it. But more importantly, I'm really impressed that you are continuing on and progressing with your treatment.
Thank you for watching our video demonstrations on implementing contingency management. For a more in-depth look on implementing contingency management, please refer to our training manual called Contingency Management Implementation Manual: How to Make This Evidence-Based Practice Work for You.
Well, I think that a big part of recovery, successful recovery, if there is such a word, is that building self-esteem and self-confidence will help you to overcome some of these obstacles you're going to have as you come through recovery. So I think that when you have succeeded with what you were trying to get done, and at the end of the week you have that chance at a reward, well, you feel good about yourself.
I thought it was fun, and it got me invested in my recovery. Rather than just being in my recovery, I was actually excited about it.
I think it was a positive boost toward an overall kind of recovery and seeking treatment services and, moving forward in that process. I think it had a positive motivation to want to attend the treatment. And not so much in the sense of, I was going to necessarily get some money for it, but it was just that acknowledgement of and validation of, okay, yeah, you did go to treatment. That was a good thing to do.
So, because I was attending more, then I became more comfortable with sharing more. So that was kind of a cool breakthrough. Because I was incentivized to go to more groups, I then became more willing to participate as time passed on. I definitely got more out of it when I started talking and sharing my thoughts. So that was a cool thing that kind of pushed me into it.
I feel, to some extent, that it helps validate or remove some stigma associated with going through it. And maybe that's just coming out of my own upbringing and my own bias towards people who are in active addiction or seeking recovery services, is that it's like some kind of moral failing. So to be part of a program where that sort of judgment and stuff has been removed and there's actual rewards to it, in my mind, it's quite refreshing and it's a nice approach to it.